evening, everyone. So we are extremely delighted to welcome you this evening. This is the fourth webinar organized by the SSAHE collective, which is the Social Scientists Against the Hostile Environment. So a few words about SSAHE. It has started as a project of the special interest group on refugees, migration and settlement established by some fellows of the Academy of Social Sciences. And it was born at the time of the so-called European refugee crisis. And it first led to a report on migration, racism, and the hostile environment that is actually available on the SSAHE website. So today, SSAHE gathers social scientists across different disciplines, from postdoctoral researchers to senior staff, whose research interests are on issues of racism and migration in the UK as well as globally. So one of the aims of SSAHE is to inform political debates and to challenge the hostile environment for migrants produced by the current government policy. My name is Marie Godin. I'm a British Academy postdoctoral research fellow at the Refugee Studies Centre at the University of Oxford. My main research project focuses on the links between new technology, social protection, and refugees' journeys. So I'm co-chairing this webinar today with my colleague, Gina Netto, who is a reader in international and forced migration at the Urban Institute in Heriot-Watt University in Edinburgh. She has published a lot on migration and integration, and more recently, she has been doing an amazing work on the need for statistics which more fully capture the disproportionate impact of COVID-19 on racialized minorities. So the webinar is entitled The Hostile Environment, COVID-19 and the Politics of Care. It's looking at how the COVID-19 pandemic has intensified the effects of the hostile environment on both care providers as well as care receivers. And our speakers today are going to discuss this topic from a range of different perspectives, including voices from academia, but also activists and grassroots and migrants' rights organizations. So before giving the floor to my colleague, Gina, I'm just going to say a few words about the structure of the webinar. So each speaker is going to be introduced in turn, and they will be speaking for 10 to 12 minutes. We will then have a discussion around 5:50. So there is a Zoom chat, and so please, I invite you to ask your question in the chat. And if you can also specify to whom the question is for, that would be very much appreciated. It can also be a general question to all the speakers. So thank you so much for attending the webinar today, and I hand it to you, Gina.
Thank you, Marie, for that kind introduction and for setting the scene so well. So just to say a little bit more about the webinar, what we're focusing on is the context of COVID-19, when during the lockdown, care of oneself, one's family, and those in the community was an overriding concern. The public and the media champion care workers as one of the essential key workers who enable them to survive during the pandemic. It also made everyone realize our interdependency on each other, as well as the economic and social resources needed to provide and receive care. So in this webinar, we will be analyzing the consequences of the financialization and privatization of social care in the past 30 years and the inadequately regulated care for the elderly and disabled on the one hand, and poor pay and precarious conditions for care workers on the other. We have 4 speakers today who are eminently qualified to speak on this topic. Susan Cueva, Ruth Pearson, Elena Kaufman, and Lynn Siegel, who between them will discuss the position of care workers and key structural factors which have led to a crisis in the provision of care in the UK, as well as the need for a new politics of care which recognizes and values its central role economically, socially, and politically. So our first speaker today is Susan Cueva. Susan has extensive experience of organizing migrant workers in the health and social care sector and in private companies delivering public services. She is a trustee at Kalungan Filipino Consortium, which is a consortium of small grassroots community and voluntary organizations. Susan, I'll hand over to you just now.
Thank you. Thank you very much. Thank you for inviting me tonight. I was asked by our colleagues to share to share some of the experiences of care workers during the pandemic. But first of all, I would also like to introduce my organization, which is Kandungan. It's a consortium of grassroots organizations of Filipinos across the UK. It is run by people with lived experience of migration. Many are carers, nurses, domestic workers. We support many of the migrant workers and refugees coming to the UK to be able to get them through the kind of hostile environment that they will experience over the period of their life in the UK. And we continue, of course, to campaign against the hostile environment in the UK. And we've been doing this in the last 25 years. I myself also came to the UK as an asylum seeker. I was imprisoned in the Philippines due to my work organizing workers in a trade union as an asylum seeker. I had experienced the full weight of the hostile environment that many people like me continue to experience until now. Our organization is also one of the founding members of the Status Now network, which since March this year has been campaigning for the regularization of undocumented people in the UK. But then, of course, as you know, the coronavirus pandemic has intensified and highlighted the deadly effects of the hostile environment. But it also reveals the life-threatening inequalities that already existed before the outbreak. Well, I was asked to share experiences of carers among migrant care workers. I would like to share two stories. One of them is a story of a nurse working in the formal care sector, and the other is a story of a carer working in the informal care service provision, which employs to a degree many undocumented migrant workers. So Vanessa is a migrant worker from the Philippines and worked as a nurse in a private care home. At the height of the pandemic, one of their patients experienced COVID symptoms, but the care home refused to recognize that it's COVID. So all the nurses got really worried and suggested that the manager should start instituting a system of isolation for all the patients. However, the manager refused to do this and ordered the nurses to swab the patient. None of the nurses, of course, wanted to swab the patient because of fear of COVID. So the manager ordered Vanessa, who's a Filipino nurse, to swab the patient. Vanessa, although in the beginning refused to do it because she feared, because she has asthma, she protested, but in the end she was forced to go and swab the patient. And she had no proper protective equipment at the time because it was like I think in the beginning of April. A few days after she swabbed the patient, Vanessa experienced also COVID symptoms. She then had to go off sick and self-isolate. And then after a couple of weeks of self-isolation and being really terribly ill, she died of COVID. She left behind a 12-year-old child who was the only person with her when she died. After talking with her colleagues, when we learned about her experience, we believe that Vanessa was forced to do the dangerous work because she was still under temporary visa. She was afraid that if she did not do as ordered by her manager, she would be dismissed and will lose her visa and right to work in the UK. She was a single mother and desperately wanted to keep her job and gain residency for her and her child. They had been in the UK for more than 10 years, which is much more than what you would need in order to gain your residency in the UK. But she has not managed to gain her residency because of the many barriers that she had to endure from the government's hostile immigration policy. Her daughter, who's now on her own, has grown up in the UK, is in danger of potentially being sent back to the Philippines. So we're supporting the family at the moment, the child especially. Another story is from Pearl, who was a qualified midwife but came to the UK as a carer. Her husband passed away and she was left with 3 children to look after, so she had to look for better paying job. In 2004, she was sponsored by a care company to work in the UK as a migrant senior care worker in the care sector, which was at the time really in dire need of carers. And also the government often opened this migrant care worker visa as a special way of supporting the needs of the care sector for carers. However, in 2007, the government changed its immigration policy and systematically refused visa renewals for migrant care workers. Because of this, Pearl lost her visa and she became undocumented. Of course, this has almost destroyed Pearl's life. She couldn't go back to the Philippines because she needs to work and to support her family. So she was forced to work as a live-in carer for an elderly woman, for working for 60 hours per week and being paid £2 per hour because she's undocumented. She endured all this because she has to send money to her children and her family. In March, when the pandemic happened, her patient got ill with COVID. The NHS only monitored her patient by phone. Pearl asked the NHS for support in looking after her patient, and she requested the NHS protective equipment, but they would not give her any protective equipment. As a result, Pearl also contracted COVID, and the family of her employer dismissed her from her work. So during the height of the pandemic, we have to support, our organization had to support so many of the migrants with similar stories. Many suffered mental health issues and problems and illness and life-threatening conditions. Some undocumented people died also because despite being ill, they had to continue to work. They could not access health services due to fear of being given high medical bills and also exposing their undocumented situation to the authorities. Many of these workers are working as carers themselves. The contribution of thousands of these undocumented workers working as carers in the private homes of people, and even sometimes in care homes, residential homes, and nursing homes, who are frontline workers, have not been recognized during the period of the whole COVID. The government refused to recognize the need to regularize their status, even though these workers have saved many lives also during the pandemic, working as carers and working as frontline workers. During this period of the pandemic, we have to respond and work with other organizations. And together with RAPAR and the British Academy, Kanlungan published a report in June, which is called A Chance to Feel Safe, where we interviewed almost 100 undocumented people who have been severely affected by COVID and lockdown and hostile environment. Many of these workers have lost their jobs. Many of them continue to work as carers, risking their lives with no safety net, no social welfare support, and was forced to live in overcrowded accommodation with other members of the community. Hence, the spread of COVID in our community is very high because of these kind of situations that we have in our community, but yet they remain invisible to British society. Anyway, as a response to their appalling condition, Kanlungan, together with organizations like RAPAR and other grassroots organizations, set up the Status Now Network, which campaigned for the regularization of all undocumented people in the UK. I personally believe that the UK government has killed many of the migrants and refugees and vulnerable Black and ethnic minority people through its hostile environment policy. It has also increased discrimination, racism, and racial hatred against minoritized communities. Our experience has shown this. Our organization believes that the reason why 25% of the total deaths among the NHS workers are Filipinos is because there's institutional racism in the workplace. And this has even worsened during the period of the pandemic, because we feel that we've been targeted as minority ethnic communities to be put into very dangerous work environment. In addition to suffering death, we also experienced threefold increase in racist attack against East and Southeast Asian communities because they think COVID came from us. Trump called it the Chinese virus. We responded, however, by mobilizing our communities and set up what is now the campaign to end the virus of racism. And we hope that this campaign will also be heard and be seen by the government, in order that images about COVID is removed and not related to our communities. Our communities, despite all the barriers and hostile environment put to us, are organizing ourselves. And we hope that we will continue to get support from the community and other British communities in the support and fight against the hostile environment against migrant workers. So for many care workers who have not been known, who have not been given the clap, the recognition and all that, I really hope that the people will recognize that many of them are undocumented and invisible in the community. Finally, I also want to say that the fight against the hostile environment in the UK should be taken up not only by migrants and refugees and people affected by the hostile environment, but also all the kind of British people and all organizations, because I believe that when the pandemic comes again, and hopefully it will not, but if it hits again the countries and Europe and everywhere in the world, there will be nobody will save unless all of us are safe. And therefore it is important to support and support the kind of vulnerable communities that we have. The hostile environment is not the best solution to the issues around migration. It is not the solution, it is a problem. So thank you very much.
Thank you, Susan, for this very valuable insights into the precarity of care workers, particularly arising out of their legal status, and also for sharing your work with us, very important work that you're doing in terms of countering the impact of the pandemic and raising public awareness, really, of how important it is for us all to be involved in raising awareness of the plight of migrant care workers. I'll now turn to our next speaker, who is Ruth Pearson. Ruth is Emeritus Professor of International Development at the University of Leeds. She's the author of several books and articles on women migrant workers in the UK, Latin America, and Southeast Asia, which interrogate the relationship between paid employment and unpaid care responsibilities. Ruth is a long-standing member of the Women's Budget Group and has published a number of briefings on care, crisis, and COVID. Ruth will speak on COVID-19 and social care and the consequences of privatization and financialization. Ruth, over to you, and I'll just share with you the slides that you'll be speaking to.
There you go. Shall I just start?
Yes, please do.
Okay. So what I want to do in the short time that I have is talk about the model of social care in the UK and how that has developed over the last 30 years in terms of privatization and the financialization of the care sectors and the implications of that. Because I think that the whole anatomy of the social care sector is often hidden from view. I want the first, can I have the first title one, please? You've gone to the second one, I want the first one, thank you. You know, until you actually need to find care for yourself or a relative, it's very obscure how the social care system works. And what I want to argue is that the consequence of privatization and financialization is that there is a hostile environment for all care workers, and obviously particularly for those for migrants and those without secure status who are vulnerable, but also for all care recipients. And that the challenge is how one unpicks this, you know, 3 decades of policy within a neoliberal environment to provide an appropriate social care service that works for both care workers and those who receive care. So next slide, please. Right, so what we've had in the UK since the Thatcher government, but really accelerated from 1990, when councils were forced to put social care services out to competitive tender. So effectively, local authorities had the responsibility for providing care, but they commissioned rather than provided the care directly. And as we'll see, the amount of publicly provided local authority care has shrunk enormously. In the residential sector, it fell by 88% between 1980 and 2010, from nearly 142,000 to just 17,000. But the other thing that's happened is in the last 20 years, there has been increased involvement of financial investors in the care sector, both domiciliary and residential, who are not service companies at all, but just in it for the profits. And this has led to the creation of really complex systems of maximizing profits and extracting profits. And the other important thing is that there's a growing proportion of those who are needing care, and particularly those older people, but also people with disabilities with working aid, who have reduced or often zero entitlements to publicly funded social care and are totally dependent on financing the care for themselves through their own pockets. Can I have the next slide, please? So what you've ended up in is a marketized and under-resourced system, which is not regulated and operates for the benefits of those who are working as a business rather than care workers or those they care for. And you'll see only 4% of local authorities, the care home beds, only 4% are directly provided by local authority delivered care homes. All the rest are in some kind of private ownership. And at the high end of the market, and this has been driven by the fact that there are increasing percentage of self-funders having to buy their own care. A lot of these companies are owned by finance companies, transnational hedge funds, and they have ways of maximizing the surplus that they can extract from the sector, what we call transfer pricing. So there's a whole complex system of linked companies who charge them rent, who loan them money, and so on, who pay consultancy and directors' fees. And in 2018-19, a total of £1.5 billion, which was about 10% of total care home income, was spent or leaked from the care system to these finance companies. And another real problem is the lack of coordination between the NHS and social care. And that is largely because NHS in principle, though we know not for everybody, is free at the point of use, whereas the way the social care system is developed, if you want public funded care, not publicly provided care, that is very strictly means tested. And if you don't qualify, then you're on your own. And there has been, over the years, since the coalition government, a fall in real terms of funding for social care, in spite of demographic aging and rising demand. So basically the system is a mess. Next slide, please. So there is a crisis now in the corporate care sector. You will be aware of the very high rates of infection and death in residential care homes, and not just of patients, but also, as we've heard, of care workers, and particularly migrant and BME workers who have been forced into the most dangerous positions. But one of the policies that pushed the increase in death was the government forced residential care homes to accept hospital discharge patients who hadn't been tested, and going back into a care home environment with very low staffing ratios, unprotected labor, use of agency staff, that it was the ideal place for the infection to spread. And one of the top 6 companies, HC1, reported it had over 1,000 deaths in its facilities by July 2020. I don't know what the recent figures are, which implies that about 12% of their residents in their 150 care homes had died from the virus. This is not, commercially, this is not a good situation for them to be in. And there has been falling profitability in the care sector, partly because of the decline of funding support for publicly funding care support. And now there's an immediate crisis because of what has happened in the care sector. Falling occupancy rates, they're advertising like mads, but who would want to go into a residential care home right now unless they could absolutely alternative. But at the same time, there is an increase in the internationally financed domiciliary agents who provide care at home. They face similar pressures in terms of staffing and costs and PPE, etc. But of course, they don't have the residential real estate indebtedness to deal with. So next slide, please. Now we know, from the previous presentation that the workforce in social care is really exploited. I've put some figures here, which I don't need to go through this presentation. I can send to anybody who wants it, or the organizer can send. But 78% of the care workforce now work for private companies. 82% are women. And interestingly, it's quite an old workforce. The average age is 43, with a quarter of employees aged over 55. There's a very high representation of BME workers. I don't know about of migrant workers, but maybe Eleanor will say something about that. 21% of the total adult social care workforce are BME compared to 14% of the population. Of course, it's much higher in London, where only 37% of the adult social care sector workforce is UK born, with 12% coming from the EU and 51% being non-EU migrants. And there is a whole question that Eleanor will talk about the implications of Brexit and the new rules on migration in terms of that employment structure. 50% of paid care workers are paid less than the real living wage. Whoops. Thank you. And, you know, as we've had, you know, with no sick pay and no organization, no unions, 0-hour contracts and things, that people are in a very difficult position in terms of resisting unfair work practices. There's a lot of issues also around domiciliary care workers. I always think domiciliary care workers get forgotten when we talk about the care sector because of the very high profile of residential care, but of course domiciliary care workers are really important. So it's a low paid, it's a racialized, and it's an undervalued workforce, and COVID-19 has illustrated that, but it hasn't changed that. And the whole model really rests on being able to maximize profits by minimizing costs, which include, it's a very labor intensive occupation. So if you can get cheap labor, and often migrants are the cheapest of labor, then you have, you know, you can reduce your costs, your unit costs, and therefore maximize your profits. Next slide, please. I have a next slide. Are they frozen? Right. What's happened? Oops.
It
Right.
looks like,
Okay.
yes.
So I just want to say something. Yeah. Okay. Just got 2 more seconds. I just wanted to say something about how, you know, what is to be done, because we've been doing quite a lot of work in the Women's Budget Group about how to change the care service sector and make it work both for workers within the care sector, but also for those receiving care. And there are a whole series of strategies that are necessary. We have called, and others have called, for a universal care service, free at the point of delivery, providing free full-time childcare and elderly care. And there are kind of questions about how it should be financed, which I'll come on to. But it's really complex to change from what we've got now, which is a very embedded, privately owned, profit-oriented sector, into a care sector that is a proper public service, and also to make care work secure and institute training and career paths for care workers. Increasing. A lot of people have argued it's a good point in time to take private care homes and agencies back into public ownership, because the property prices are falling as residential care is in crisis. Interest rates are virtually negative. And as we've discovered, there is a magic money tree. And our polling suggests that the majority of the population would be willing to pay higher taxes in order to provide an appropriate, free, proper care service. Last slide, please. Gina, right, thank you. Okay, so what we've also argued in we recently reported from our Commission on a Gender Equal Economy that we need to create a caring economy. No, previous one, please. A caring economy which would prioritize well-being rather than economic growth, which would invest in the social infrastructure, and that means the skilled people who provide services as well as the physical. That this would be a rationally sensible strategy, that investing in care provides a better economic stimulus to build back a better economy than investing in construction projects like HS2 and so on. And incidentally, it also provides more and better jobs for women. And investing 1% of GDP in care, if you invest 1% of GDP in care and construction industries, if you invest it in care, you get 2.7 times as many jobs as investing in construction. Now, if you increase the wages of care workers so that they are proper average wages, then you still get a very big direct and indirect stimulus to the economy. So I think what our main message is that all this clapping from care is just a sentimentalization of care, that we need to politicize it, we need to place economic value on it, and we need to put it at the center of our economic strategy. So I'll stop there. I put at the end of the presentation the references where you can get more information. Thank you.
Thank you, Ruth, for that very persuasive argument on the need to, an economic argument on the need to reconsider the role of care in the economy, and for pointing out the contribution, the potential contribution that care can make to the economy if we rethought how we conceptualize care. So can I now move on to our next speaker, who is Elena Kaufman. Elena is just one, yes, sorry. Elena is Professor of Gender, Migration and Citizenship and co-director of the Social Policy Research Centre at Middlesex University, London. Elena has written extensively on both skilled and less skilled workers in care sectors. And recently she completed the UK report on the quality of the personal and household services sector, job quality and industrial relations for the European Commission. Elena will speak on care and the uncaring politics of migration. Over to you, Elena.
Sorry, thanks very much. Pleasure to follow on from Susan and from Ruth. And what I want to address in this short presentation is the politics of care in relation, is the politics of migration in relation to care. And the fact that has been said by both speakers so far, it's very lowly esteemed. And then to look at what the proposals post-Brexit might mean and how we might want to challenge it in a number of different ways. Now, I think that we really do need to rethink I would call not just uncaring policies, but actually inhumane policies, as I think Susan has really picked up so well, that are currently in place. And I think that will be, in fact, reinforced post-Brexit, because what we're going to be seeing is that a whole group of a population that is now not under the hostile environment or partially only so will be brought into it, that is EU citizens. Now, I also want to, when I talk about migration policies, I'm not just talking about policies of entry, but I think it's also very important, again, going back to what Susan's point has been, is that we need to look at the policies that are post-entry, the kind of everyday bordering that Nira and others have written about. So it's also not just about crossing borders, but what happens internally to those borders under the hostile environment. And here we've got no recourse to public funds, checks on access to housing, health, including the health surcharge and education, amongst others. Now, therefore, what you could argue is the migration policies in this broad sense are so important in their impact on the availability of care, availability of the care workforce, its remuneration and its conditions of work, both by those who are documented and undocumented on the one hand, and the other side, and I think Ruth has also talked quite a lot about this, the access to high quality and sufficient care by different populations. Because as we've heard, I think as Ruth has mentioned, care is very much rationed in terms of getting access to publicly funded care. Yet, as we see, of course, care which has been so much clapped for, we've realized that it's essential, that it's a key element of society, has consistently been devalued and treated as very low skill by immigration policies, and therefore, of course, undeserving of the right of entry. Now, the current post-Brexit policies, as we'll hear, will reinforce this as the government seeks to source globally the brightest and the best in its fixation with the highly skilled. And as it closes the door, of course, to free movement, it will in turn subject EU migrants to the same control and hostile environment that are currently experienced by non-EU migrants. So you might want to think, what's in it for them to come to the UK? A very good question. And there's very little indication that it's responding to the implications of COVID or the growing awareness by the public that care workers as well as health workers are essential and that they're in sustaining the lives of all of us. Indeed, it's very interesting that it's done everything and it's bent over backwards to offer an extension of the visa without a health surcharge to health workers, but it adamantly refuses to do this for care workers. So the visa, which is called the health and social care one, is actually very wrongly named. So I want to consider three issues in the presentation. First of all, what's the current situation in care provision and the politics of care? Secondly, what are the post-Brexit migration proposals? And how might we shift towards migration policies that are less uncaring and produce, in a sense, by a caring state, working towards a caring economy? These are huge issues which I will only be able to touch on very briefly. So the current provision, Ruth has gone into quite a lot about the privatization, financialization. I'm not going to go into that. But what we do know is there is a massive shortage of about 120,000 care workers in the sector. Workers are very poorly paid. Even when they're paid the minimum wage, they may not in fact get the real wage for the time that they're putting in. There's an extremely high rate of turnover in the sector, and over 40% of domiciliary workers, and that was the second case that Susan was talking about, are actually working on 0 hours contracts. Now, the actual conditions in the UK, we talk about the UK, but they're very different between the 4 countries. And in fact, England is the worst because the other, Wales, Scotland, and Northern Ireland all have much better, an attempt to register workers, but also try to provide better conditions for them. Now, the skills in the care sector, and this is very important for migration policy, are represented as being embodied and innate, i.e. they're equated with what women know and they know how to do it well. So why do you need to train them? I would argue this is, of course, a way of maintaining low pay in the sector. Yet, as Lydia Hayes has remarked, many of the modern ways of doing the care needs currently often require considerable medication and complex procedures. And so she's actually arguing that we've replaced district nurses with far worse paid care workers. And hence many characterize the sector as being dysfunctional and one in crisis. Now, for many years again, governments have said that they will tackle the underlying issues. And here again, we've seen Ruth's outlining of what some of the issues are after decades of privatization and underfunding. And there was a green paper published in 2017, but of course we've got no further. Now, in this context of a poorly paid workforce, migrant workers from the EU and beyond have played a major part, as we've heard, in providing much needed labor, which is also, as we've heard, has a massive turnover. However, what we also know as a result of that turnover is many EU workers and other workers move out of the sector once they improve their English and acquire knowledge of the labor market. There are also a number of non-EU workers who've not entered the care sector directly as labour migrants, but in fact have come through other routes. And indeed, interestingly, in the Kanlungen study that Susan has been involved in, it mentioned that of the 78 workers who were surveyed, about half had entered as students, international students, that is. And of course, some of my students have indeed worked as carers. And just under a quarter had come in on a tourist visa. But by the time of the survey, and some of these workers had been in the UK for over 20 years, 59 of the 78, or 3/4, were now undocumented. I would, however, submit that we should be careful about constructing the care workforce as solely a migrant or minority ethnic one, except probably in London. For the work that we did for the Personal Household Services Project, I actually analysed regional statistics in the sector by citizenship and locality by ethnic minority. You can't get the two together. And you find that it varies hugely between regions. So you have regions such as the Northeast, the Southwest, Yorkshire and Humberside, which have very low proportions of both migrant workers and minority ethnic workers. And in fact, again, if we think of the Ken Loach film, Sorry We Missed You, which was set in Newcastle, it's no accident that Abby was the overworked domiciliary care worker, is from the white working class. This is not at all unusual in many regions, certainly. Okay, so to move on to look at what does post-Brexit, what it might it mean. Now, again, it's actually quite interesting that last week, the Migration Advisory Committee, MAC, published a review of what would be its recommendations for what they call the shortage occupations list. And there was consternation from foundations, from NGOs and so on, that yet again, care was not placed on the shortage occupation list, except for senior care workers, who only comprise about 10% of the workforce. Now, this is not, as Susan's mentioned, a new situation. We can go back to 2006-07, when under the Labour government, the category of senior worker carer was actually created. And it was somebody that who had NVQ 2 or 3, and who would therefore be able to enter. Now, cutting off the flow of carers from beyond Europe was seen not to be a problem, because what would they get? But post-enlargement, they would have EU workers. This time, however, we're in exactly the opposite situation. We will, in fact, lose that source of care worker. Now, MAC, in typical fashion, has argued for a long time that immigration is not the answer and higher wages would solve the problem. We all agree that higher wages would solve some of the problem. But what's very interesting with MAC, which could do with a feminist economist, I think, for the first time with COVID-19, it's recognized that care workers at least are essential and key workers. And this has been recognized by the public, by some Tory MPs, and with strong support from various foundations and NGOs. But MAC is still absolutely adamant that higher wages and not tinkering with immigration is the best solution, even though it's understood finally, after many years, that care work is undervalued and that this might be contributing to shortages. In fact, it recognizes that a care worker who's paid £8.72 might be worse off than working at Aldi for £9.40, despite the fact that the care worker is, of course, doing very arduous work with considerable responsibility. And as we see with COVID, of course, taking up huge risks. Now, asked why care workers couldn't benefit from the fast tracking and cheaper visas being offered to healthcare professionals, Boris Johnson said, social carers are not eligible because the government wants employers to invest more in training and development for care workers in this country. And then he said, our independent migration advisors have said that immigration is not the sole answer. And that is why we have provided councils with an additional 1.5 billion of funding for social care in 2021-22. I thought, well, if that's the way they're providing money, as they have with other things, I don't think we're going to see very much of that. We also see, as I said earlier on, an unwillingness to recognize the value of care work in the refusal of the government to extend visas beyond October and without a health surcharge, as they're being prepared to do for health workers. Now, MAC and the government are clearly hoping that the loss of jobs, and they've kind of stated that from COVID, will push some workers into the care sector, and they are undoubtedly right. But what they've also tried to what they're also counting on is that some of those coming in through other routes will also do care work. And I've mentioned some of these, for example, such as students or family reunification migrants. Now, one of the reasons why, one of the main reasons why the points-based system is so inadequate to and rigid to actually recognizing the value of care is that it's based on income. And again, there's been a number of studies showing that women in particular will find it harder to come in under the PBS than men. It's also adamant that you have to have an RQF3 or A level. And the problem here is that carers are seen as by MAC as only having the equivalent of RQF1. And of course, one of the problems here, and this comes back to the lack of training, but the lack of sense of any need to have a minimum level, is that makes it very easy for MAC to basically say that this is an unskilled, a totally unskilled sector, and therefore, again, not worthy of being allowed to enter because there are no formal qualifications for it. Now, I'm not going to go into the details. It's actually, although the government thinks that the points-based system is simple, it's actually not simple, and it's quite complex. So the problems here lie not just in the fact that care workers can't earn enough money to qualify, but it's also the fact that there is no minimum qualifications in the job, and therefore that it gets classified as the bottom end of the skilled, or by for MAC, a totally unskilled. Now, apart from, attention has been focused on increasing pay to make up for the deficit of what will undoubtedly be an increasing a shortfall because of EU workers not finding the UK attractive, and of course I would suggest the EU workers here who will find it increasingly unattractive due to the hostile environment. But as Ruth has actually mentioned, changing the whole way in which the care sector works will be long-term. It's not short-term. So the issue of trying to think that you can fill the shortages by increasing the wages will certainly not be adequate given the size of the shortages. But also I would argue that if we want to aim, and this is my third point, is what should a caring state do in order to achieve a caring economy? We can't assume here that the need for care will be the same as it is at the moment. So we first of all have to understand that even if wages were substantially increased, without the current rationing that we have at the moment, there would be a huge increase in the need for care. Obviously, this would be very positive because We know also, one of the things the Women's Budget Group has pointed out is that increasing numbers of largely of women are actually forced out of the workforce because they're having to provide the care because the person who requires it is not entitled to publicly funded care. And also, again, that need for care may well increase with COVID because what we know is that we have an increasing number of long-term effects from COVID, and therefore that may also require additional care. Now, I've only gone into the PBS very, very briefly, but basically it's not fit for purpose. It's too rigid. It's fixated with formal qualifications. It doesn't recognize the value of labor, the value of work for a society beyond that of the highly paid and the more highly qualified. And so I think we need to really rethink, obviously, not just the caring economy that Ruth has suggested that we do, but also that we have to think about what about an uncaring state and an uncaring immigration policy, and what do we do with that? And neither of those, of course, is going to be an easy matter. But I think we do have to start to unpick and challenge the hostile environment. And we secondly have to unpick and challenge the immigration policies that are being proposed post-Brexit if we want to move some direction towards a more caring state in a caring economy. Thanks very much.
Thank you, Eleanor, for those very sharp observations of the impact of the new immigration policies and Brexit on care workers and the very grave implications for social care and what we need to do to counter this. Our final speaker is Lynn Siegel, who is Anniversary Professor in Psychosocial Studies at Birkbeck University of London. Lynn has published many books on gender, feminism, and politics, the most recent one being Making Trouble, Life and Politics, Out of Time, The Pleasures and Perils of Aging and Radical Happiness, Moments of Collective Joy. She is currently working on the politics of care and disavowals of dependency. As part of the Care Collective, she has co-authored the Care Manifesto, and I now hand over to you, Lynn.
Thank you very much. It's great to be here, especially as I had such great trouble getting on. Birkbeck disconnected my email and other things. But anyway, I'm here now, which is wonderful. So, as we all know, it's been so interesting listening to you all. We know that there's nothing new about this crisis that we're in around care. It's just been exacerbated, but not caused by the current global pandemic. Of course, we were warned that there was likely to be a global pandemic, but our government simply pushed that aside and did nothing about it. So, as you've heard, I'm one of the authors of the Care Manifesto, and we formed a very small care collective to think about all the multiple crises of care that were so obvious around us. Really a crisis of care from cradle to grave, with people not being able to have time to care for their children, through to, you know, the disastrous situation of the lack of care for the elderly, again so highlighted by the devastation of older people in care homes, whose deaths in the early weeks of the pandemic were not even recorded. So dispensable were these older people thought to be. So seeing this crisis, we immediately thought, oh, we have to write a manifesto. We've got to get someone to do something about all of this. Of course, we weren't the only ones doing it. There was the Women's Budget Group, there's NEF, there's all sorts of people who've been working for a very long time, like you all, precisely on this wretched situation that we're in. We know that we're in it because of decades of neoliberal policies prioritizing profit over people. Indeed, in particular, the years of austerity that followed 2010, the new Tory Lib Dem government which came in precisely because of the crisis caused by neoliberal policies, and their solution was to ramp them up even more and to introduce even more austerity. And it's also gone along with an ideology that is contemptuous of care, contemptuous of dependency and our interdependence. And that, of course, started explicitly with Thatcher, with her treating people on benefits or anyone in need of support from the state as scroungers and slackers and so on. Of course, it wasn't only Thatcher, it was a global ideological move promoting neoliberalism, which really has proved successful ever since, because nobody likes to feel themselves dependent, even though we all are dependent. We all depend on each other. And so a lot of work we do in the Care Manifesto is showing the ties between autonomy and dependence. And without us being given the resources to be autonomous, then we can only live the most shriveled and incomplete lives. And nobody's argued that better than disability activists, who have shown that it's precisely because of their needs, and we all have needs, of course, it's precisely because of their needs that they need support from the state and from others to have some sort of autonomy and be less dependent. So there's a total connection between dependency and care, where the rich, as we know, have their caring needs met all the time. They have whole armies of dependents, and it's precisely those who actually have the most material, immediate material needs who get less resources and care than anybody else. And this devaluing of care also, again, as we know, ties in with generations, indeed, a whole history of the gendering of care and the devaluation of women, the sexism that's always been a part of our society, going back to Eve, it would seem. And women's work, their caring work, not only being seen as some natural instinct which they could just do, which they didn't need being paid for, but that work being seen as unproductive. So one of the main thrusts of women's liberation was always, of course, to show how important was the caring work which women did. Only recently that's begun to be factored into the economy through the work of people like the Women's Budget Group and feminist economists, showing, you know, how greatly, how absolutely we depend on the caring work women do. But that it's been mainly women who are doing it, because there's another side to that story, and that is just when there's been shrinking resources, shrinking benefits, everybody actually getting relatively poorer, apart from the super rich getting massively richer, everybody, women as well as men, are being forced to work ever longer hours in paid jobs, whether it's caring jobs or other jobs. And what that means is that there's been a huge care deficit in richer countries. And so we're completely dependent, again, as others of you have said, particularly discussing Filipino workers and others, on a global care chain. And those usually women coming to richer countries as part of those, in order to offer caring services here across the board, you know, from caring for children to caring for the elderly to sexual servicing and more, that they have been even further devalued. Racism has allowed them to be treated with even greater carelessness and contempt. And of course, the hostile environment, you know, which was out there so emblazoned on those vans, go home or you'll be arrested, has only intensified the xenophobia, which has also been growing in recent decades and is simply another side of neoliberalism, trying to blame the least powerful, or blame anyone, to scapegoat anyone actually for the obvious failings of the system. And as Eleonore tells us, this of course is what's fed into Brexit, and what is going to create an even greater caring crisis. Those coming to take up the slack now won't be coming so much from Europe, they'll be coming from further afield, and they're going probably to be treated even worse. So it's that care deficit and who we rely on that's been further, I think, further diminished what should be the very real valuing of care. And again, as we know, there's a hypocritical side to that, with everybody going out during the pandemic, clapping the carers. Suddenly we notice that these people who've been begging for pay rises just to be able to live in homes so they could get to work more easily, or get to work at all, and being ignored year in, year out. Suddenly we're clapping them, although of course what we're not doing, what we absolutely haven't done, is still give them a pay rise. But the other thing that we emphasize in the Care Manifesto is that care isn't just hands-on care, important as that is, crucial as that is, but hands-on care can only be done well if there's time and flexibility to do it. Now, time and flexibility is just what you don't get when you're doing paid caring work, because actually the logics of care and the logics of the market are completely at odds. And many people have quoted that film, Sorry We Missed You, where you saw that it's been the case that care workers have consistently had to keep clipping time that they can spend with those they're caring for, ignoring their actual needs, and practically destroying themselves by wanting to do a decent and a proper job, but simply being denied the possibility to do a proper job. So what we're arguing in the Care Manifesto is that our values are completely upside down. Healthy communities rely absolutely on adequate caring facilities. And we have been making the provision of good caring services almost impossible for decades. And the racist environment we're living in now, the increasingly hostile environment we're living in, has very much added to the ways in which it's become more and more impossible. And in the manifesto, what we're saying is we have to see that to have a healthy, caring society, we not only have to revalue care and all the incredibly real skills that go into hands-on care, which is very difficult, which actually can create conflict and ambivalence, whether we're being paid to do it or not paid to do it, because it brings us in touch with, our mortal and often, difficult aspects of the body. So it's exactly, all the things that we need to think hard about how we can help people do these jobs, that we're giving them no help at all. And the sort of help that they should be giving takes us through not just to the importance of the essential services of education, where you should be learning caring skills, and of the public provision, not just of libraries, but the lending of goods between each other, the sort of mutual aid which we do see in times of crisis, which we've seen in this type of crisis, where people really look out for their neighbors and think, well, what do they need? And go and attempt at the best of times to help them. And that depends on having healthy communities. It depends on there being adequate money for local governments to support caring work, not only to provide good care homes, although the care homes have been taken away from them, which is why we saw so many deaths, not only of inmates, but also of carers in care homes. And also when we saw those deaths, we also saw something else, that it was ethnic minorities who were in the front line and the predominant ones who were dying, along with those who, who were in the care homes. But no, we have to rebuild our communities. We have to see that a healthy community is essential to healthy families and healthy individuals able to go out and work for those wretched profits for the super rich, or preferably do more meaningful work, not be a part of the 40% of bullshit jobs that most people are doing and know they shouldn't be doing. But actually the least bullshit jobs are, of course, caring jobs. But it seems the less bullshit your job, the less money you will be paid. There's an inversion of what we should be valuing. So what we're saying then as well is that healthy communities depend on a healthy state that wants to value their own communities, and so knows that their money should be going not to reducing taxes for the wealthy, but actually into allowing more socialist and caring neighborhoods. But that in turn again depends upon a sustainable world. And so caring for us takes us to every sphere of life, you know, from the family level, which we hope to expand into more mutual aid, which we call promiscuous care, to communities, to the state, and then also to caring markets. Markets actually don't have to be the type of global for-profit markets we've seen. We could have more cooperative markets. There are all sorts of ways in which markets could be regulated far more than they have been, and the offshoring of the economy could be brought back onshore, the sorts of things that are argued by Ann Pettifer in the Green New Deal. And the Green New Deal, of course, takes us not just to how we create caring economies, but how we create a sustainable world. So that's why to talk about care is to talk about how we operate across all levels of life, as well as how we care across the lifetime from cradle to grave, a lifetime which in these times of peak inequality, as Danny Doyling has described them, we've seen less and less and less ability to care at any level. So I'm hoping for a complete re-envisaging of how we should live. And actually without that, as we know, for sure, because the climate crisis is already upon us, we're not going to have any sustainable future at all. So surely at this moment of rupture, which we're still in, you know, it's been precisely the most neoliberal of countries that have had the very worst results in relation to COVID. Here in the USA, in Brazil, is where we've had the worst results. And in other countries, there's been far better ways of dealing with this very predictable pandemic. So now is the time, it seems to me, to say what life is about is seeing our interdependency, acknowledging our own fragilities, and to attack sexism and the gendering of care, to attack racism at every level, and know that we ought to be caring for each other, both near and far, and that would begin to address so many of the problems which we've all been discussing. Okay.
Thank you very much, Lynn, for the very passionate argument and connecting so many different themes together and reminding us again about the centrality of care in our whole society. So I'll hand over now to Marie to pick up some questions. I know we have a couple of questions in the chat. Marie, you're mute. Marie, you're mute.
Is it okay like that?
Yes.
Yes, okay, good. So yes, so we have one question for Suzanne, and it's from Nando. So he's asking, how can you make visible the exploitation of undocumented migrants and mobilize in the age of social distancing?
Well, shall I answer it?
Yes, I mean, I'm just going to remind everyone that it's the time to ask questions, so you can really use the chat. Yes.
Okay, I mean, from our point of view, we have always, and from the very beginning, have encouraged many of the undocumented workers, especially those in the working in the care sector, and of course, you know, working in private houses as carers, domestic workers, nannies, to organize themselves and to be able to be confident enough to speak about their issues and to speak about their situations in the work, in the area of the work that they're doing. We believe in the ability of the grassroots people, the people themselves, to speak for themselves, to be able to understand and to be able to analyze also the situation in why they are in these situations that they are now. And that part of that is to also engage with other migrant and other communities who are suffering similar kind of irregularization and undocumentation. So that's one of the reasons why we've set up our campaign for regularization through the Status Now network, which is over 100 grassroots organizations a member to it. And we've been lobbying MPs and held dialogues with MPs and our undocumented people themselves, talking to MPs about the situation. We've also encouraged many of our undocumented people to speak up and be open in terms of their condition through the media. Over the period of the pandemic and the severe lockdown, we've managed to get many of our undocumented people to speak with the media and to express and to share their situations and their experiences under the lockdown and the hostile environment. So our way of doing this is really to empower our communities, to get as many support as possible from other organizations like yourselves, and to network with a broader group of organizations so we can have a stronger voice to fight out the hostile environment in which we live in, and also to be able to, and we hope we will, to a degree, at a certain time, we will win our kind of campaign to regularize many of the workers. If the government is talking about, you know, limiting the number of workers coming to the UK, there are a lot of workers here already who are trained, who have experience and who have skills to be able to do the work that is needed in the country in order to fight the pandemic, and they have been doing it behind the scenes. And therefore, I think it's time for the government to recognize that these people has to be brought out of the shadows and put in the limelight and recognized as frontline workers in the UK. Thanks.
Okay. So yeah, so we have another question. How so MAC, so the Migration Advisory Committee was mentioned in a few of the presentations. And so I have one question to all the speakers that who mentioned it. So how to engage with MAC? And if so, have you done so?
Dear, sorry, shall I answer?
Yes.
Sorry. No, I haven't. I haven't engaged with MAC, but one of the things is when they have their consultations, they call for a number of NGOs to respond to their consultations. And in fact, one of the reasons I think that this time there has been a bit of a shift. So there's a bit more of an understanding of what care represents, because their older understanding was basically the value of your work is what you're paid, which any feminist would not recognize. So there has been a shift now. So they've actually openly said, we recognize that care work is not properly paid. And they're very strongly argued that it should be paid between about 10 and 12 pounds an hour instead of being paid at £8.72 and less. So I think it is worth pressing them, because partly the government always touts them as being independent, and therefore they are an important body to actually engage with, whether you're going, but I think there are a whole series of groups which responded to their shortage list. There were two very critical studies by the Welsh government and the Scottish government. So there are a very wide range of bodies that have responded. I don't know, again, whether Canlungan or other migrant organizations actually responded. It would be worth pursuing that.
Okay. Is there anyone else who wants to add something?
Yes.
I missed the question.
So,
Has anybody engaged with MAC? That was the question.
Yeah.
well, maybe we can just continue with the questions, because there are a few of them now. So a question to Ruth. Are any political parties supporting the universal care policy, or or was it a service? Have you made some calculations on what it would cost? Ruth. Ruth wasn't there.
No, I'm here.
Oh, yes, sorry. So did you hear the questions? Did you see it?
No, can you repeat it? Sorry.
So are there any political parties supporting the universal care policy that you mentioned in your presentation?
So, the universal care service. Well, it's interesting. It was originally a campaign by, I think it's called the National Federation of Pensioners, and the demand was for a national care service, and it's moved on to being universal, because what's a nation? Is it England? Is it Scotland? I mean, all those kind of questions. And it is supported by a coalition of disability groups, Keep, NHS, Public, and so on. And I mean, we've just launched the Women's Budget Group has just launched the Commission report about creating a caring economy. And there are some meetings. I mean, there was a meeting with the Conservative Party conference yesterday, and there's sort of various meetings of political parties and trade unions and things. So I think there is quite a lot of support for that. I mean, the real question is, how is it going to, is government going to put money behind it? And are people going to be kind of paid properly? There's a demand for a college of care, like other kind of medical and health colleges and things, to professionalize, but also to recognize the value of it. But it's it's a long struggle, and that what you get mostly is who's going to pay for it. And as Eleanor says, you know, the government has dumped their commitment to sort out the care sector. So it's a long argument.
Okay, thank you. And one question from Don Flynn to the panel. So could you say something about the role of trade unions in organizing care workers? So is there current structures and politics up to the task? So this was perhaps for Suzanne in particular, but I think everyone can say something about it.
Okay. We, of course, as a grassroots organization, work very closely with the trade unions. And because I particularly also used to work with the trade unions, organizing many migrant workers and carers in the different workplaces, I think that there's a lot of things that needs to be improved also and reviewed in terms of how trade unions organize and support many care workers, because the care sector is very fragmented. It's very, you know, you'll be dealing with thousands and thousands of employers, which is a nightmare for any union or, you know, trade unions that deals with negotiating and improving the working conditions of many care workers. I think that there's a lot to be improved there. I mean, I think many unions are now in the process and have been over the past years trying to find ways and strategies in which they can get as many trade workers in the care sector. So, for example, you know, 4 Seasons as a collective bargaining agreement with Unison and other unions like RCN and other associations that operates in this trade sector. I think there has to be also some very clear and very structured way to approach migrant care workers in the care sector, because the care workers in the care sector are much more vulnerable. Knowing how vulnerable workers are already in the care sector, the migrant workers are even more vulnerable, and that the difficulty is that many unions finds it difficult to address the issue of the intersection of immigration issues and employment rights. So that's a very difficult area, even for many lawyers who would, you know, deal with the immigration issue only and will deal with employment issues only. So that's an area that needs to be addressed. Now, I think there is beginning to be many community organizations also dealing with supporting care workers in the industry. But I think, and I want to say this again, with many undocumented workers working in the care sector, that is even more difficult, and that makes the kind of organizing and working with them even more difficult, because
Susan, I'm afraid I'll have to stop you because we are running out of time, and it would be, I'm really sorry to have to stop you, but neither would I want to wish without thanking everyone for their very, very stimulating and important discussions. And to the audience who've joined us, we have a very big audience joining us, and also for the very interesting questions that are now emerging on the chat. Thank you all for a most engaging and valuable session, and for joining us this evening. Good night, and thanks also to Eleanor in particular for bringing together such a great collection of speakers. Thank you.
Thank you.
Thanks, everyone. Thank you.
Thank you. Bye.